Chairman, are you in? All right, we have a board meeting coming up in the next 30 minutes, or actually 15 minutes, so perhaps he could be readying himself for that. So I will share my screen shortly. Give me a second. So there we are. Please, may I ask that if you want to speak, you raise up your hand. There's a function at the bottom. If you click to your right, you'll be able to see those options to raise and to lower your hands if you want to speak. Those of you who have burning points that you really can't keep, but you think you can actually forget, please use the chat, the group chat function, so that you can actually key in your thoughts there. We'll be able to collect them. If you have questions as the presentations go on, you can actually also use the functionality of group chat to write those questions and to the targeted panelists so that we can actually direct those questions to them. So allow me then to just take you through briefly about what is it that we've been doing. So the status of things, starting with Kenya versus some of the comparator countries we've actually looked at, and in terms of the long-term perspective, how we see us faring as a country. Today is the 48th day since we last reported the first case of COVID. And for all those comparator countries, you're looking at on the screen, South Africa, Brazil, you're looking at Italy, you're looking at UK, US, Singapore, South Korea. Where were they on the 48th day? Look at the curves, and you'll actually see that from somewhere mid towards the end of last month, March, our cases in Kenya actually started flattening. And of course, so is the case with South Africa. You can see how other countries fared on around the same time when they were in the different phases of their cases. Well, this is really not to give us comfort so that we relax whatever is it that we are doing, but this is just to say that as a country, we are actually doing much, much better compared to most other countries. You can see how UK was on an upward trajectory. You can actually also see how Brazil was faring on. You can see Italy, and of course, US. You can actually also see the upward trajectory of US. But we came into this, we were a bit lucky to come into this about 1.5 months after Corona actually hit the world. And by the time we had the first case reported, we had had about a month plus of learning from what other countries were doing. So perhaps that's actually why we've been able to learn from the experience of other countries and been able to put into place necessary measures to ensure that we actually control this from spreading in the country. This particular slide looks at Kenya and East Africa. And by the time we rolled out testing on a larger scale. The rest of EAC countries had actually not started testing as much. In fact, Rwanda was actually the first to lead on this, and then Kenya. People were actually questioning why there are more cases rising in Rwanda and in Kenya, but that is probably because the more you test, the more you're actually likely to find that you actually have cases, because we have amongst us in our population people who are actually asymptomatic. They have COVID, but they're not actually showing that. And this is the greatest lot of people actually spreading corona, because as long as you're feeling you're just okay and you can walk around without a mask, you are actually spreading corona. So that's why we really need masks for all. Whether you're feeling well or whether you are feeling unwell, you must really have masks. It protects you. You could actually be lucky that you're still okay. And by wearing mask, you actually protect yourself. So by the time, for instance, Tanzania started testing massively, you can actually see how their graph has actually shot up from the 29th day. So basically, that's what this graph tells us, that actually the more you test, the more you're actually likely to find that you actually have more positive cases. Confirmed deaths in Kenya versus other countries. The trajectory, also look at the shape of the graphs for other countries versus Kenya. We have fewer deaths. I know we had, there had been some predictions, but that by end of April, we would actually hit 10,000 confirmed cases. Yes, that was a prediction based on business as usual, Kenyans going about their businesses without taking much regard to protecting themselves. So that is what the prediction was all about. But I think with much advocacy around this and much awareness, we've been able to address this by actually increasing awareness and the risk of not wearing masks. So that is basically what has enabled us to keep this as low as possible. And this is the daily tracker, some of the things that we do with BCG, the daily tracker of cases by geography and testing. The accumulating figures, confirmed cases so far, 384, deaths, 15, recovered cases, 129, tests completed, 17,000, and so on and so forth. We'll be able to share this much later on. Amongst us as private sector, across different sectors, we are doing a lot. The healthcare, agriculture, manufacturing, financial institutions, construction, all other sectors. There are things that we are actually doing, contributing in our own various spaces to curb COVID within our industries, but also reaching out with a lot of empathy to Kenyans to help out. So this chart, this graphs, rather this screen basically shows what is it that we are doing across different sectors. And we really do not have much time to go into this. Today's occasion is actually dedicated to this eminent group of panelists to talk to us about what they understand about the impact of COVID on children, youth, and women. And we should be done in about 30 minutes, 38 minutes of their presentation, then we can open it up for Q&A. So ladies and gentlemen, allow me to welcome our first presenter, Gloria Ndekei, to tell us about the impact of COVID on children. Thank you so much and welcome, Gloria.
Thank you. Can you hear me?
Yes, we can hear you.
Okay, thank you once more, and good afternoon, participants of this very great session. Mine is to look at the children's effects on the COVID-19. And what I looked at, which has similarities, are the effects of 2014 Ebola on health systems in a case study that could actually be compared to COVID-19 in Kenya. Ebola outbreak in West Africa debilitated the healthcare systems, hubs of transmission, Curfews and borders made it harder to obtain medical services and continue drug therapies. There were reduced childhood vaccinations, which later increased deaths among children and infants. And we have also seen in Kenya, whether there are mothers who are struggling to get maternity care during curfew, and they are not able to take children to healthcare for fearing
I'm on mute.
COVID. Just to give you a little statistics from Kenya, 39% of, hello?
Yes, Chloe, we can hear you.
Hello, somebody mute your screen. Yes, 39% of Kenyan population is under the age of 14 years old. 22% of children are fed in accordance with recommended guidelines, meaning that there are lots of children whose diets do not meet the diversity. There are 26% of children are under 5, who are under 5 are stunted. That is shocking. And 11% of children under 5 are also malnourished, which basically means COVID-19 will likely escalate nutrition and health challenges facing children, especially those who live in low-income settlement areas. Children are likely to bear devastating long-term negative impact in spite of milder COVID symptoms and lower mortality rates. And this is due to family stresses, where widespread job and income loss and economic insecurity among families are likely to increase child labor, sexual exploitation, teenage pregnancy, and even children or child marriage. Joblessness and lack of income for parents will result in unhealthy foods that could cause stunted growth and wasting of children. Other diseases to children and young children will be as a result of increasing incidences of parents not being able to take those children to hospital due to that fear, which we have mentioned there earlier on. There are also, and they have been reported, increased incidences of domestic violence due to stresses on families. We have also looked at the impacts, further impacts due to vulnerability and psychosocial distress, where large numbers of children might be orphaned from the disease. Children we know are vulnerable to exploitation and abuse, and abandonment, especially for the street children, has already started happening. We have also seen uncensored TV news and programs on COVID-19 without much explanation to the children, which may cause emotional distress. Those of you who have done the psychosocial impacts of children under age 7, children don't understand what is happening around them. It will take the mothers to explain, it will take the parents to explain, the fathers to explain exactly what is happening for them to understand. Otherwise, they understand their own things and they start having a lot of emotional distress. Closure of schools has also the effect of the quality of education, potential contribution to the economy, disruption of schedules and routines for these children, loss of contact with friends and their social structures, and also children living with disability who relied on special schools for treatment, support, recovery are bearing the brunt of the school lockdown. This is not to appreciate the fact that the lockdown has also protected the children from a lot of happenings that would therefore bestow on them. However, we are looking at the impacts and even the negative impacts that this has on the children. And we shall also speak to the solutions. Is that so, Victor, later or now? Victor? Hello? Hello?
I was on mute. Yes, so that's it. Thanks a lot.
Yes, I'm asking, we are going to speak to the solutions later.
We'll speak to the solutions later. Let me invite Evelyn.
Okay.
I'll come back to you, Gloria, and thanks for elucidating those the different ways in which children are actually affected. And the problem is actually children really do not speak these things, but they're suffering internally, and this can actually affect their long-term life. So we'll come back to potential solutions. So may I welcome in Evelyn?
Thank you, Victor. Gloria's presentation was really excellent, and it provides a perfect segue to what I'm going to speak about, because the effects of the pandemic on children are actually more or less the same as what young people are experiencing during this period of the pandemic. And I also want to agree with what you mentioned earlier on in the presentation, that investments in youth, adolescents, and women are needed now more than ever in Africa. If you look at the youth population, we're actually experiencing a youth bulge, not just in Kenya, but
Evelyn, you went off.
below 35.
Sorry, we lost you. We lost you for a few seconds.
Benefits of this demographic dividend is by ensuring that we are having investments in the youth. Looking at COVID-19, as the pandemic continues to spread, young people are having to worry about different issues. What's really important right now is the need for governments, partners, and development agencies to understand what exactly young people need. We need to understand what the youth priorities are. We need to understand exactly how we are being affected by the pandemic. So the basis of my discussion will be a survey that we are carrying out currently with our Act Youth in Action network in Kenya. We have a network of over 700 youth-led organizations across the 47 counties. And we've carried out a survey with the youth, and we've been asking them, how is the pandemic affecting your lives? How has it changed your normal routine? What health services are you not able to access? So I'm going to highlight just 3 emerging issues and underlying factors. One is psychological trauma and distress. Gloria has already pointed out to this. Young people are saying that they're not being able to see their family and loved ones as often as they would have wanted. There's a lot of worry, anxiety, and stress around the pandemic. And another contributing factor of psychological trauma is the fact that there's significant decline in income. Decline in and actually loss of income. When you look at young people, I mean, most of the youth run small and medium enterprises. A lot of these have been shut down. A lot of young people are saying they've had to go on unpaid leave. That is for those who work in the formal sector. Majority of the young people are actually working in the informal sector, and these have been affected more than other sectors during this time of the pandemic. So it's causing a lot of psychological trauma. The sad thing about loss of income is not so much the fact that we didn't see this coming. What's really sad is that when we're preparing for this pandemic, we knew that there's going to be loss of income. But then the policies that are being put in place right now are focusing on the older cohorts. We're not looking at young people who are affected by loss of income. And so if we are not careful, what this will actually lead to is increased cases of crime. We're looking at civil unrest being a big possibility, because if young people do not have income, the next thing will be to go out on the streets and to riot. So this is something that the country and the government needs to look into. We need to ensure that we're having concrete solutions being put forward by the government to address the issue of loss of income. The other thing we need to do is, of course, ensure that the mental health, the resources are being put into mental health, counseling, and of course, ensuring that there's adequate referral systems. One of the other challenges that we are seeing is negative social behavior Again, this is a manifestation of the unrest and psychological trauma that we are seeing amongst young people. So we are seeing a lot of drug abuse. We are seeing irresponsible sexual activity going on because of the effects of the pandemic and what that's doing to our lives. The third thing that I'm going to talk about is displacement of health services. Now, this is two-pronged. One, the fact that resources are now being focused a lot on mitigating the effects of the pandemic. And secondly, young people are actually fearing to go to health facilities to access routine services because they fear to contract the virus. And the underlying issue here is that in as much as the government has developed protocols and guidelines to ensure that citizens' health is protected when they access routine services, the public is not aware. So even young people are not aware that, that they should be able to go and access services routinely and that their safety will be prioritized. And what this has done is that young people are actually saying that they're no longer going for services such as HIV testing and counseling. Young people are no longer going to access services such as contraception. And the effect of this is that, after the pandemic, we'll surely see an increase in the incidence of HIV. We will definitely see an increase in the cases of teenage pregnancies and unwanted abortion. So we need to ensure that not just young people, but citizens are actually aware that they should be able to access routine services normally. We need to ensure that these services are available even beyond the curfew hours. The last challenge that young people have put forward is the fact that there's lack of coordination, of the efforts that are ongoing. So we have many resources and tools out there. Partners have come up with many initiatives. You're seeing the government is also coming up with many initiatives and putting out policies. People are trying to get on social media and leverage on digital platforms to help young people, but then there's no coordination. You cannot find a single platform where there is information that has been collected across the country that will benefit young people, not just in the urban regions, but young people in the rural regions, in the pastoral region, the coastal region, resources that enable youth living with disability to be able to cope with the effects of the pandemic. So there's a lot going on in the country, and of course people are trying to target and ensure that young people benefit, but the lack of coordination is becoming a big hindrance to achieving the full potential of these resources. So young people are really calling out on everyone to ensure that we have coordination. The last thing, I know I alluded to this, but the fact that there's loss of income, young people have also expressed the fact that there's an increase in cost of living. Young people still need to ensure that they have food on their table. They need to ensure that they're paying rent. This has not been adequately addressed by anybody. So this is becoming a big challenge. And this links very closely to what I talked about earlier on the mental.
Thank you so much, Evelyn.
Thank you.
Yeah, we'll come back to you. Maybe what I would want you to then look at that you haven't touched, but you could actually look at or speak to, or maybe anyone in the group would, is there's actually a very considerable population of young people who are taking care of their old parents. Right? Yeah. So
yes,
they're affected as young people, but then also the multiply effect of these young people also taking care of their old parents is quite huge. So we'll come back to that. Allow me to invite Eva Muraya.
Okay,
Eva,
thank you very much. Yes, thank you very
much. About what's so special about how women are affected?
Victor, thank you. And I think you've prompted an interesting discussion I had this morning with my dad, who has always called me Maitu, which in my mother tongue means, he reminded me that the mother, Maitu, which means mother, is one who holds the truth. You are my source of truth. So when you ask me what is so special, maybe it is to first say that women are potentially or currently our source of truth. but also to quickly say that you really did say it well when you said $100 is perhaps a lot better managed in the hands of women than if it is not. So having said that, first, the slides you have shared with us concerning the now flattening curve means that there are things that our government must be saluted over, doing quite well. But like you have reminded all of us, the war is still on and it is real. And there is a very critical role for us as women to play. I also want to say that my namesake Evelyn, as she has presented everything on youth, it reminds me that our recent census did reflect that women comprise more than 50% of our population. So everything that she has presented directly impacts at least more than 50% of the youth of Kenya. So you can see that all the challenges she's represented there do affect women. But having said that, I think that we want to be reminded that women carry every day nearly 11 to 12 hours on care work, compared to an average of 2.5 to perhaps 3 hours of care work by men. So what COVID, this pandemic, has then meant, because schools are closed and etc., it means that we have increased by a large percentage the time poverty that is always attributed to us as women in the balancing of taking on extra responsibility that would otherwise be shared at a community or school level. Our income streams, for the most part, have been disrupted, if not totally lost. So that's the other impact that this has caused. We are also dealing with huge numbers of communities that are yet to access the protective equipment, be it masks, be it access to clean water, because the primary way in which to fight this pandemic is to wash our hands with soap under running water. And we know that especially in the informal settlements, this is something that is not very easily accessible to most women. COVID has also impacted us at a relatively sad level when we talk about rising levels of gender violence that have been witnessed. This has led to our psychologies being really ill-suited to manage the increased burden of responsibility at the home front. Businesses have been closed. Those in formal engagement, especially the SME level, beyond the micro level, there are industries that have completely shut down. Education, event management, the beauty side of business, and others that we can enumerate have completely been put on standstill. Others are dealing with stalled contracts that have been either held back as clients wait to watch the result of the pandemic, or when it is we can reignite, which means that that has either delayed revenue generation or put to threat a lot of that. There are also concerns around incomes because contracts have perhaps been cancelled altogether. So issues of reduced or complete loss of income is a reality. That then means we have had challenges around providing basic needs such as food, healthcare for our children, and remember that we were coming out of an already very strained or stressed economy. And then, of course, the lack of adequate sanitary pads, because the curfew hours are there, because we cannot afford it, has meant that there's other negative behaviors that have set in. Evelyn can bear me witness, we are dealing with a lot more increased sex for sanitary pads or sex for food, which really now just compounds an already very complicated situation. I also want to highlight the fact that by the stigma that surrounds COVID makes it more difficult for women to have the confidence to access reproductive health services in clinics or hospitals because they don't want to go to what is perceived as a COVID-19 area. So access to the healthcare is complex, or even to sexual reproductive health services is complicated, or even to take their children for the normal or regular immunizations is compromised. So some of these are really the burning effects of what it is that has affected us as a constituency of women. Have there been some measures put in place? Absolutely. People have resulted in a lot of innovation to manage this. I was very delighted to hear that there are women amongst the SME categories or closed or disrupted have resorted to setting up agricultural solutions. So they are beginning to farm, but then this then presents an interesting challenge if you've not been a farmer before, especially those in the urban areas, a lack of immediacy in technical skills. And then of course, farming is not an overnight thing. So there reign a probable solution, but that may not bear the immediate result of if you are running, say, a beauty parlor, a hair salon business, a restaurant that is able to give you disposable income more immediately.
Sorry, Eva, we lost you.
Feeding program, essential products. I'm saying that there's been great innovation with our women. So perhaps your business has been disrupted, but you quickly readjust and adapt and set up solutions around providing or brokering on personal protective equipment. People are stitching masks. People are producing sanitary provisions like the soaps and the sanitizers. We've also found solutions with an excellent initiative around Wheels for Life that allows us to access healthcare services for pregnant women after the curfew times. Issues of social media engagement, a lot of support coming through because people have set up either counseling services or training services. So there's some degree of technical support that is now accessible. However, the divide between those who can access technological devices and the internet also then presents an interesting challenge.
Thank you so much.
There are also, all right then.
Yeah, I want to invite Ray, but I'm actually being reminded, Eva, even as we talk about women giving 3 times the care to their family than men, right now we are all locked into our homes. Both the men and women actually at home. No one is going to the bar, no one is going to work. Have we seen any changes in terms of how men step in? We'll come back to that. Allow me on this slide to invite Raymond, which is the Secretary for Youth in the Ministry of ICT and Youth, to share with us some of the measures under his department in terms of what the government is actually doing around this particular demographic population of Kenya. So Raymond, if you're in, please unmute yourself and come online, please.
Thank you so much, Victor, and I'm really glad to hear Gloria speak about the children. And Evelyn has also really expounded on matters youth in terms of how they are affected, the psychosocial support and need, mental health challenges that have come. And also, Eva Muraya has also really dovetailed into the same with much emphasis on women, which again, the constituencies of the women, quite a majority are young people. I just want to state one thing. The COVID-19 is a pandemic that is a global new normal that has caught everybody off guard. Not only the developing world, not only the underdeveloped, even the established countries. So everybody is grappling with this matter. And I believe this has also really added to the bedrock of challenges that we had before. When you talk about the young people, the Kenya National Bureau of Statistics census of 2019 indicate that Kenya's population of 47,564,296, indeed below 35 years of age, we have 35 million, which accounts for 75.1% of the population. Then the youth age between 18 to 34, which are 13 million, comprise of 29%. And let me go further just to indicate that the report also continues to show that out of the unemployed youth, out of the unemployed group in this population of 47 million, 84% of them are young people, 64% are underemployed. What am I saying? These are still come and added to the baseline of the challenges that we had before. We've been having and grappling with the challenge of youth unemployment. And the pandemic has also put us and thrown us into the deep end of, we are trying to figure out how do you go about it. Let me look at the two in what government has been doing into two areas. One is the on-COVID intervention and the post-COVID intervention. As you watch what the international community and the benchmarking countries are doing, right now, most of them have started to talk about the post-COVID-19 recovery. What are some of the recovery strategies that we are going to be having? But in the immediate sense, as Kenya as a developing world, we have most challenges go to an extent of just the basics of food and water, and the basic things to do with sanitation. You've heard about women cannot access air service. One of the things that we are doing as a department in collaboration with wider government is then to look at how do we address the needs of the vulnerable, especially when it comes to the basic and the immediate needs. And one of the things that we are doing right now is we've partnered with various partners, and we're doing food distribution within the informal settlements. I know it may look not a long-term measure, but what young people are saying, when you say we stay at home and we don't go to work, then how do we have the strength to run our families? Because some young people are living by themselves, some are fending for themselves. And today we were in a conversation with UNFPA on a Twitter chat today, and it comes out very clearly that look at even the entertainment industry, and I believe Eva Muraya has also captured that very well. Look at the entertainment industry, the service industries in terms of the hotel chains of businesses, who are the waiters in Javas and all these value chains. They are young people. And as we speak, most of these restaurants and the clubs who are closed, and these people are at home. And to emphasize what Eva said, that even we have reached a point whereby now even women are even exposed to a point of sex for food. So food is very critical in terms of this moment. But another thing that also we're trying to address quickly, Victor, is the socio-economic dynamics of the young people. The government has just launched the National Hygiene Program, where we are looking at how then do we enable and come up with a cash transfer system that does not just give young people money for free, so that we also embed a culture of tokenism, but looking at a way of how then do we engage young people to do meaningful things within their communities. And we are talking to line ministries. So right now we have the Nairobi Metropolitan Services, so that they give us aspects of drainages and clearing the roads and disposing of masks and everything that you are seeing that disposal right now is a challenge. How then do you engage young people within their localities and communities to undertake certain duties, and then they get supported? That one is a very critical area. So the moment we're going to map up all these interventions and communities, and then we have line ministries pay the young people to do this job. So we're going to roll these also out of Nairobi. We have piloted right now within 8 regions, but we are also going to go to all counties. So we want to partner with the other entities, and I believe Kenya Private Sector Alliance can also really come in handy in this. And the other aspect that also is very key, that I must say what the government is doing, Victor, is the aspect of sanitization and sensitization. And I believe this is some of the things that came up when I joined in terms of look at what our neighboring Tanzania is doing. They went into prayer. They ignored the basics of what the government has done. And we have to laud and applaud the Ministry of Health and the government at large in terms of just pushing a sensitization to an extent whereby we believe putting on your mask, washing your hands. As much as Kenyans say, why do I wash my hands before I get food? Yes, it looks that simplistic. It's very easy to bash such a campaign, but look at where it has taken us. We are almost talking about flattening the curve, and we just must congratulate our Kenyan society through a very tough interaction. They've come to accept that this is an area that is also going to help us do this, because if we start dying, how will we then do business? So those are some of the things that as government we have also done. And lastly, we have also been doing a lot of social media and online interaction. And we are also trying to bring various cohorts like the Boda Boda. We have been told that the Boda Boda community has so far 1.2 million bikes that are on the road. And these are people who are, most of them are young people dealing with clients, and they can also transmit the virus. So then how do we use this cohort also to reach out to them? As much as we say Kenya is a Boda Boda community, it's a huge cohort that we must address. So we are also working with them. But what I think looked at the context that we have here, how they're looking on yet.
Sorry, Raymond, I think your connection is deteriorating. We can't hear you well. Maybe we should come back to you, Raymond. You had great points to share, but unfortunately we can't hear you. Or is it me who can't hear him? Can we hear Raymond? Maybe it's only me who can't hear him.
I think we lost him.
Oh, okay. Yeah. So, Raymond, I think we'll come back to you to add on to your points. Let's go to the next. In terms of solutions to minimize impact on COVID on children, I want to invite Gloria. Gloria, you may unmute yourself.
Yes. Thank you very much, Victor. I'll speak to the solutions. And one of the, as I speak to the solutions, I would like to bring to the attention that the global economic and national challenges made both parents move out of home to go to work. And I am looking at this COVID time as an opportunity for parents, both or one parent being at home and catching up with a few things we do not understand about our children. So there is an opportunity there for the parents to catch up, to look at some of those traits we may not have been looking at when we go to work very early in the morning and come very late in the evening. I'm looking at issues of the family being the first socialization unit, where children are supposed to get a lot from, but the global challenges have been a problem. So probably we may have to look at education, look at it more seriously. This time, both parents or the parent who is at home is present, and even look at what is being fed through the television stations, and ask probably to upscale more children-friendly programs, which we are able to interrogate better now that we are at home. I would think that the parents need to take up the role of giving explanations that give hope to children, because this is what is going to lessen the issue of distress among the children. And we should prioritize efforts to continue education for all the children using available technology. Most of our parents now, most of the parents today are educated in one way or another. They are not like our grandparents or probably our parents. So there is a window here where we can pick up the gaps and do our socialization better, maybe lay down programs even for future or post-COVID, having understood what our children need. When we look at essential services, there is need for continued providing of economic assistance, including cash transfers, and somebody spoke to that, to low-income families, so that they can also be able to meet the basic needs of these children, so that the children do not resort to child labor or early child marriages. And minimizing disruptions in children access to essential and life-saving healthcare services. This is probably by working with the private sector, further in government, so that the turnaround time of women when they want to go night, or probably a child is sick at night, or even the other children, permits should be given, or the turnaround time for that access should be very, very, very minimal. And then, of course, the issue of awareness, expanding public education and awareness campaigns for children-related matters, such as feeding, violence at home, and sexual exploitation, and making the children understand some of these issues better. Radio messages in vernacular to alert families on the need for healthy and nutritional services. And if I go down to nutrition, of course, mainstreaming nutrition in food distribution response to improve dietary diversity. This basically means that when we are doing food distribution responses, sometimes families are given unga. This unga probably is not so healthy for the infants and the very young children, because it is not probably fortified properly, it doesn't have the essential mixes, and therefore cannot be said that it is healthy for growing infants and very young children. And of course, the issues of vitamin A supplementation, these are the times where parents, probably in these vernacular radios, can be explained to, so that they understand the importance of good diets for the children. And good diets don't have to be expensive. It's just about trying to explain, and especially to the low-income groups, settlement groups, to understand that probably terere, and that terere is amaranth with ugali could be better food than just the ugali, or probably uji, which is not mixed with other fortified foods. So some of those interventions could help the children. Thank you. Hello? Hello?
Thank you so much. Thank you so much, Gloria. Could we hear from Evelyn in terms of some of the solutions to the problems you mentioned? Raymond, will come back to you. We lost you in the midst of your presentation.
Thank you, Victor. Raymond already mentioned very good examples of measures that are being put in place by the government. So I'll just talk about a few. One, with regards to the policies that are being put in place, we need to ensure that these policies enable young people to have alternative sources of income. And these policies need to go beyond COVID-19. We've seen right now manufacturing opportunities being expanded to young people. We are seeing university students developing ventilators. We are seeing companies engaging young people to develop or make soap, masks. So we need to ensure that young people are getting alternative source of income through these other sectors. but also we need to ensure that these policies go way beyond COVID-19, because the effects of the pandemic will go beyond the demographic losses that we are seeing right now. This is also the time to activate social security funding for the youth. I strongly believe that the transfers that are being made to the elderly should also look at the youth population. When we say 75% of the population is young, and we look at the statistics that Trey has given with regards to unemployment, we really need young people to be able to access funds at this time, social security funding, and looking at the fact that they've been saving for this. The second thing is that we need to have digital platforms for continued engagement of young people as we develop these policies for COVID-19. And some of the exemplary work that I've seen include the Kenya Young Parliamentarians Association. They're actually launching a Tubonge Live Hangouts today. So they're giving a platform for young people to have a discussion with young parliamentarians and to actually tell them what they need during this time of the pandemic. I know one of the key issues they'll talk about is mental health. So we need to see such digital platforms being leveraged on at this time to ensure that youth voices are being heard as we develop policies for COVID-19. We also need to have more collective efforts by young people, more movements, more resources being put up online. We need to see more innovation labs and hackathons being set up. I know the Ministry of ICT and Konza City have launched a challenge for youth innovation. We need to make sure that these opportunities for innovating do not just benefit young people in the urban region. And innovation doesn't just include technology. In order to ensure that young people in the rural region, in the pastoral region are benefiting from innovation, is by ensuring that whatever solutions they're coming up with at that level are using a design thinking approach, such that we're looking at the end user and ensuring that the needs and priorities of the youth are at the core of the solutions being developed. So if we continue having innovation labs, we expect to see different models being developed, such as drones to provide services like contraception to young people in the rural regions. We want to see mobile apps being developed that can enable young people to access counseling services for the mental and psychological distress that they're going through at this time. My second last point is on partnerships. And I can see that was clearly outlined by some of the presenters. We need to see private sector coming up through their corporate social responsibility to provide products such as sanitary towels to vulnerable girls. We need to see discounted products being given to not just young people, but the general population. Then, of course, lastly, we need to expand SRH, not just SRH, but generally health services to young people, HIV testing and counseling, mental health. I'm looking at the priorities of young people when it comes to health. That's why I'm prioritizing this. But generally, we need to expand health services to the young people. I'd forgotten to mention that based on the fact that health is devolved, we really need to see county governments stepping up their efforts. If you look at what Mombasa is doing right now, they're paying quarantine fees for the public. So young people might actually be motivated to adhere to directives when they know that in case of anything, county governments are bearing the costs of their treatment. So we need to ensure that county governments step up their efforts and meet the costs of these expenses related to COVID-19. That's it from me. Thank you.
So much. Eva, before we come back to you, we'll actually wind up with you, but we have Raymond. You want to finish your thoughts on, because your thoughts actually tie in with some of the solutions we have from government side. Then we'll go to John. Raymond?
Can you just tell me, when did you...
Sorry, again, we've lost you right now as you're trying to speak. Sorry, sorry for that, Raymond. I think we'll go to John Carey. John, if you're online.
Hello, can you hear me?
Yes, Raymond, we can hear you.
Oh, yes. So where did you?
You're still breaking and going off.
Okay, fine. You can hear me now?
Yes.
Yeah. So I just wanted to confirm where did my points hang so that I just continue
we actually lost you where you're talking about the national hygiene program, where we need to engage young people into meaningful jobs that have dignity.
Yeah. Then to proceed on, just add a few things, is that part of the things that we have been also doing is to engage young people online, and this is through the digital platforms in terms of how they can be champions within their communities, and how they can also take up the challenge.
Oh no, Raymond, I think your location has internet problem. Sorry, do you want to try another gadget? Maybe your phone? Sorry, Raymond, do you want to try another gadget?
Okay, fine. Let me try my phone quickly.
Yeah, just try your phone. Meanwhile, we go to Joan Kiri.
Okay.
Thank you. We'll come back to you.
Hello, can you hear me? Hello.
Yeah, please carry on.
Okay. A lot has been mentioned. I will start with what Gloria was mentioning. Gloria talked about the children, and I'm glad she also mentioned the disabled child. It is at this point that parents have discovered that the teachers play a key role in mentoring their children. So I would like to talk about the children and how the psychosocial solutions. Though Gloria already has mentioned, I just want to emphasize majorly on the disabled child, who normally they actually go to disabled schools for the disabled children. They're taken away from the community, now they're back home. Are their parents able to take care of them? Or will they have delayed milestones? Children with cerebral palsy, children with the delayed milestones, mentally handicapped children. At this point, they are home. Their parents are home. So do we have measures in place that have already been put for the children to be able to, for the parents to be able to continue with where the teachers stopped? I think it's a good point that we can handle the children and talk to parents. It's at this time that also the government and the education system can sit down and strategize on the best way. Can we think about community-based rehabilitation, comprehensive community-based rehabilitation for the children, where parents are also taught as they take their children to school, some of the things they need to do when their children are at home. The youth, the most active people in the world. What Evelyn also mentioned, the solutions to the youth. We know there are a lot of psychological issues. Right now, they are home. They can't move, they can't mingle. All they do is internet. What are some of the measures that we can put in place for the youth, apart from the internet? And I'm glad that Evelyn also mentioned that they have measures already in place about the youth. The rural woman, Evelyn, the other one ever talked about the rural women in general. My focus is on the rural woman. What about them? What about the rural entrepreneur in the village who they might have access to technology, but do they have technological know-how? Do they know how to use this technology to get market for their produce? So that is also important for us to think about as we discuss on mitigation measures during this COVID-19 pandemic. Because we know right now it is not business as usual. COVID has become our new normal. So as we continue, as we discuss and agree as a panel and as a group, what next? the psychosocial solutions would be, and I think every panelist who has already spoken has mentioned solutions. I would want to focus more on the rural woman, the rural entrepreneur, the disabled woman in the village. What about them? We know women in distress when they go to their chamas. That is where you sit, you talk, you discuss, and get ideas, laugh. Right now, you cannot talk. You are home. You are marooned in the house. You're with your children, you're with your husband, who probably is never at home, quote unquote, who's probably is never at home. So what about them? What about their distressing measures? How can they distress?
John, we are all at home.
We are all at home.
We are home.
We are home. But the joke is, we are home, but what about that woman in the rural area? Right now, we can all work. The woman in the urban area can work. We are online. We are still Instagramming. We are still on Facebook. We are still on Twitter. We are still getting to know what is happening in the real world. But the woman in the rural areas does not have that privilege. So what about her? What about the woman who depends on going to the farm, getting her produce, and taking it to the market? How is she able to sit at home and provide? So that is also something that I think we should also think about as a panel, as we discuss and agree on what is going to happen. I am glad that every panelist has given a solution. So even as I'm supposed to talk about psychological solutions, it has already been spoken about. It is already home. Gloria mentioned that right now the children are at home, which is a good thing. I think it's an amazing thing, considering that most parents, working parents, they leave in the morning, they come back in the evening, the whole day, the children are with the teachers. When kids close school, parents are still working. So this is an opportunity for them to also learn to be with their children, learn what is it that drives their children. It's an opportunity that I think COVID might have come with a lot of negative aspects, but at this point, I think it came with a help for the children. For the youth.
Thank you so much. Thank you so much, Kiri. John, I think there's a lot to learn from COVID. The things we thought we could not do easily, here we are doing them. There's a lot of technology around our businesses. There's just a lot about a standstill life that COVID has actually caused, but also enabled us to inspect ourselves into our inner capabilities that we wished away and we didn't think we could actually handle. And at this juncture, ladies and gentlemen, looking at the hour, I want to open it up a little bit for 15 minutes because our participants have actually been waiting on the call. I can see a lot of chats going on, which means they have a lot of questions to ask us. Then we will actually wind up with each of you in terms of your last remarks, and you can touch on the things you've not spoken about. So I will want to open it up to the participants online. If you have a question, if it's something you really can't ask and you can just text on the group chat, please do, but kindly raise up your hand so that we may pick you out. Anyone on the call who has something to add, a question to the specific panelists?
Hello.
Hello, we can only identify you if you raise up your hand.
I've raised my hand, Albert.
Albert?
Yes.
Albert, please carry on.
Yes, sir. Hello, everybody.
Hello.
Okay, my name is Albert Migowa, and I'm an emotional intelligence facilitator. Mine is to, connected to the psychosocial solutions, is to introduce the aspect of emotional intelligence, and this will cut across all the key areas, that is for children, youth, and women, because right now we are experiencing a myriad of emotions, and it's important to be able to understand and manage our emotions and know how best to deal with the anxieties and stress levels that we are handling, and also figuring out how can we move forward in as far as being resilient is concerned. So mine is to introduce the aspect of emotional intelligence as a psychosocial solution.
Hello, Victor, can I come in?
Thank you so much, Albert. I don't know what you meant by introducing emotional intelligence. Should kids have emotional intelligence? Who should have this?
All of us, all groups.
What is emotional intelligence?
The ability to understand and manage your emotions and that of others in order to have productive relationships.
Do we really need to go to school for this? Is it inborn? Is it something we all have?
Not necessarily. Some have it, but it's important to enhance it and bring it out.
Thank you so much.
Yes.
Joan Kiri, that is for you to tell us how this is supposed to be done. Yeah.
Yes, Victor, can I come in?
Another one on the call, James Ngobeli. James, please carry on.
Yes, James Ngomeli.
Yes, carry on. We can hear you. I think he's having problems with his connection. Anyone else? Albert, you may lower your hands.
Yes, Victor, yes, Ngomeli here.
Yes, please carry on.
Okay, my question is about the rural woman. I've not had a solution from Joanne about how do we empower that rural entrepreneur woman? How do we get her empowered? How does it come in this conversation around? Because those are the 70%
we haven't covered. Sorry, James.
Are in that category. Thank you.
All right, we had you, but I was saying that's a section we have not covered in the presentation. We'll come to that, and I think Eva Murai will speak to it. Ida Kanini.
Yes, thank you all, and thank you for the good presentations. My name is Ida Kanini. I'm a monitoring and evaluation and gender consultant, as well as I have a background in health. Mine is especially on monitoring. How are we going to monitor our cultural aspects, which we've been fighting for so long? I know we've talked about the gender, the gender perspective fights, the beatings that are happening in homes. But what about the circumcision of girls? This is a fight that has been going on, but right now we know the non-government organizations and also the government organizations that have been tackling this problem are no longer really there down in our rural homes. And also the police, people know right now everybody is concentrating on COVID-19. So I don't know really how we are going to look at this, otherwise we'll have a reemergence of the same issues that we've been tackling. Thank you.
Thank you so much, Ida. If I could chime into your question, a lot of things have changed about our lives, about our culture, including about whether we actually go to church physically. Yeah, so I think there are things that we can actually say as a country that we are unable to do as our culture really demands us to do. I think even part of our culture is actually to go to church, and we've seen that has also been cut off, and we all understand that sometimes life is more supreme, and a few other things can actually be suspended for the sake of our life so that we can actually carry them on if and when it is safe for us. But I will allow the experts to speak to that. That was actually my thought about your question. Someone else? There was another hand. All right, Emma Nganga.
Yes, thank you, KEPSA, for this session. My name is Emma Nganga. I work in crime prevention. My background is in gender and development. My question goes to Evelyn Karijo. She talked about digital platforms in terms of an awareness creation, but we keep talking about digital platforms. Yes, they are a good avenue, but we forget about the element of digital divide. What about the people in the informal settlements? I personally have worked in the rural areas, and technology is the list of people's, priorities in the rural areas. So when you talk about using digital platforms, what will you do for those people in informal settlements, in the border clusters, in refugee settlements, in the rural clusters to access these digital platforms? Because it is a challenge and I've seen it. So that is my question to Evelyn. Also, Raymond, I talked about the National Hygiene Program. Again, how are you creating awareness about this natural hygiene program to the grassroots? Because again, grassroots ndio kuna shida. Sorry for speaking Swahili. That is my question. The issue.
No problem. We understand. You can ask in Swahili. Thanks.
Okay, thank you.
Yeah, Patricia Murugami.
Hey, good afternoon, everyone. Thank you very much, Kepsa, for putting this together. I think a very insightful conversations around what we can move forward. And I want to tie up something that Albert Migoa and Emma said a few minutes ago. So with respect to people finding internal solutions, being a leadership catalyst, leading breakthrough leadership transformation, one of the pieces of work we've found ourselves doing is helping leaders find and acknowledge their emotions. So I want to tie up what Albert was around emotional intelligence. It may sound like a very big thing, but half of it is even acknowledging the emotion that someone is feeling and giving them a roadmap to appreciate how to navigate that. And I think that's something that as KEPSA we may want to consider, because from our experience, when people start to acknowledge that we're actually in something called a state of grief, and we are grieving the loss of many things, for some even the loss of people's lives, and acknowledging the stage of grief that researchers have done, and now that we can bring down to our level and help us acknowledge it, gives us much more power and gives people a lot more power on how to navigate this crisis and to come out on the other end. Then the second point is tied to what Emma was saying around the digital access for a lot of Kenyans. I've heard us talk about the rural woman, but some of the women are not rural. They're right here as our neighbors and friends that they can't afford the bundles to even get onto a call like this. And so I'm wondering from a KEPSA perspective, whether we may want to consider working with the radio stations and seeing what can we do, because people have a very big following with the radio stations and in some of the radio networks, whether it's in specific vernacular languages or even just using English and Kiswahili, so as to start to enable, elevate, enrich, and empower both men and women with respect to what this crisis is doing to us and how you can actually ride it and ride the wave and come out of it, because knowledge actually gives a lot of power and freedom in terms of knowing how to solve this problem. So those are my two proposals on how we can move this forward. Well done, KEPSA, Eva Muraya, and the entire board on putting this together.
Thank you so much, Patricia. Allow me to go back to my panelists. Eva Muraya, the rural woman entrepreneur, what are some of the solutions you would prefer to them?
Okay, thank you very much, Victor. Lovely to hear from you, Dr. Murugami. Always a pleasure. Now, maybe we can look at this pandemic two ways. Without a doubt, it has been a huge devastation on our social strata, economic strata, our cultures. Our sense of confidence has been badly impacted. Our planning has just been completely disrupted. But perhaps we can want to look at the silver lining, because every situation, irrespective of how grave, will always have a silver lining. Now, I think moving forward, and I like that Patricia has qualified that beyond the rural woman, there is a woman today in the urban area who perhaps has been ensuring that she is able to feed her children because she puts together a few shillings, organizes nutritious food, and takes it to a construction site and sells it daily. that has been taken away from her. Many of us living in the larger Nairobi areas are seeing many women who are out of work because they can't access the homes where they provide domestic support to families, professional women who have gone to work. Those women are out of work for one reason, because perhaps the professional woman is now back home and can do quite a bit of that. But the real reason is that many of those women are afraid that they may be conduits of the virus. Where am I going with this? As Kenyans, we need to start thinking very deeply about issues around the infrastructure. I have seen somebody on the chat saying, how is Kenya preparing for the next pandemic? Are there opportunities for us now to go back to the drawing board and say, how do we engage both the rural woman and the woman who can craft, to rethink the way in which people will begin to live and provide the requisite social distance, quote unquote, so that tomorrow's pandemic will find us better capacitated economically and infrastructurally. The other one is, there is a woman or two or 10 or 50 whose businesses, either in construction or beauty or event planning, has now decided to look at agriculture. Is it fair for Kenya to continue the heavy dependence on imported food, rice and others? So perhaps the opportunity now is to go back to the table, private sector, county government, national government, and say, that woman who is a banana supplier in the local market, must she just supply bananas for retail on the day? Can she not be capacitated at a technical level, provided access to credit, so that her volumes of banana, her volumes of maize can be sufficient to supply the county needs? So for example, those are the ways in which I think the silver lining can begin to show up. At a KEPSA level, back to the issues of grief, and there is a lot of grief amongst us. One of the areas that we are considering to do, to get into as soon as is possible, is to create a recovery center. A recovery center that will help businesses, whether at a micro, SME level, to go back and find this help. Whether it is debt restructure, whether it is issues of mitigation, or even issues to rethink contracts that have gone wrong, issues of HR, issues that are of psycho support nature. This is how we are hoping that that can happen. And in there are opportunities for us to develop sensitization programs that then can run either on local media or on online media, local radio stations, vernacular, regional, county, so that the sensitization of this pandemic and the future post this pandemic can be articulated to our different audiences. With your permission, Victor, let me very quickly also speak into some of the opportunities that we have considered at KEPSA, or perhaps that we can continue considering. We would also want to see the government really become intentional around the AGPO opportunities for our women, youth, and persons with disability at county, so that we can begin to become manufacturers of things that we have proven to ourselves we don't need to depend on other nations to import. And in doing so, we are able to then build cottage industry, and that speaks into the opportunity for the rural woman, speaks into even the woman in the urban center. And that then also begins to say, where is the capacity for us to build this woman to become astute in becoming a government vendor and supplier, and for government to be true to what AGPO stands for, to provide fair chance to women, youth, and persons with disability on these opportunities, to give fair chance in terms of the quality of the orders, to pay on time, and to ensure that that opportunity helps the woman, both in rural and in the urban, grow and scale her business. We want to also accelerate, and I think there is effort courtesy of our line Ministry of Gender and Public Service, for helplines that have been set up for gender-based violence. But Victor, when you say the men are home, perhaps that's also something that has ignited the acceleration of gender-based violence. We want to see halfway houses where these women can be rescued, protected, cared for. They can heal from both the emotional and physical wounds. We want to see proactive systems to alert authorities and for authorities to respond and respond decisively when these cases are recorded. And one other one that is extremely critical is to avail mediation services, especially for women who remain time poor, who may not have as much disposable income. Mediation services to discuss or renegotiate lapsed contracts, rent negotiations. You had a restaurant, you had a salon somewhere, you had a catering business for a school, you are running a school, you're running a training institute, and now there's issues concerning rent, yet genuinely you do not have the revenue because of the reality of COVID. So having mediation services provided in order to accelerate the recovery for us would be something that we would be very, very proud to see realized.
Thank you so much. And on the point on this last point, I would want to bring in on the AGPO, whether Raymond really has something to comment on that. Raymond, we come back to you again.
Thank you so much, Victor. Let me comment on the issue of AGPO and the rest of that I just wind up for good. The AGPO, we know very well that is 30% procurement opportunities for women, youth, and persons with disability. And I want to confirm that during the COVID period, we have emphasized and we have channeled a lot of youth-owned businesses to make supplies for masks and everything. I believe that intervention should just go beyond terms of Eva Muraya said, something that is not only on the government side, but there's a lot of apathy, the young people, in terms of the uptake. So we are going to step up our sensitization, which was going on. And as you're aware right now, COVID is the main thing. And in terms of looking at AGPO, and the president has pronounced himself on this in terms of the payment around AGPO. Actually, what some of the huge challenge that you have with doing business with government and the government agencies has been delayed payments. And you get young people taking loans and they cannot service these loans. So we have to get that done. And I believe the president has given a directive. On the other part about the youth-owned businesses, there's another thing that I want KEPSA to highlight on this conversation is that we have come up and discussed with the Youth Enterprise Development Fund, and we are going to be rolling out a kind of a COVID-centric intervention for the young people. And we want to support youth-led businesses to ensure that if they had a challenge during this COVID, we are going to support them. So that's something that has been discussed, and Youth Fund is coming up with a plan on this. So we are going to be taking up those who have been, who are on the database for Youth Fund, who have been getting funds, and right now they've got a challenge. Maybe their businesses were closed. Some cannot pay their employees. Some cannot now even order products into their shelves. We are going to look at that other point. In terms of the National Hygiene Program that was raised, how then do we do grassroots mobilization? I want to assure you, this is not a boardroom flagship. And as you can see, as you will be seeing, we are involving the youth officers on the ground. Government has got youth officers on the ground. And we're also involving the assistant county commissioners, who are also the former chiefs, who are on the ground, and the Nyumba Kumi leadership, so that we must make sure that we get young people at the grassroots. They must be youth, and they cannot be identified from Nairobi. They're not be identified from the boardrooms. At least we're going to be addressing that cohort. And then the other part that had also been mentioned before that I want to emphasize is the digital and hackathon that we are launching with Konza Techno, so that we're going to be having an innovation challenge. And I believe I also share the link so that after this, you are also going to share that so that we can have young people who have got interventions around COVID and innovations around COVID, how they can be supported with prize money, and then beyond in terms of how they can be incubated and be grown and be connected to funding. Then lastly is the aspect of Ajira Digital. The Ministry of ICT has got their Ajira Digital platform. That is a platform that then young people can also register their online jobs. And we have young people who are earning from online jobs. And that would again also be very critical. I know that we'll also be saying that then that is not enough because not all young people are addressing internet, but at least for now that we are limited in terms of how far we can go on physical interaction, then these platforms can also be very relevant to the young people. You had also, the government also announced in terms of the creatives, because we've got right now that aspect of the society whereby we have young people who are very creative and they're in the creative industry. And right now, they cannot entertain, they cannot perform. And again, there was the 100 million that was raised in terms of that the president committed that is going to be given to the creatives. So the government is putting everything in place. I also just want to look at the way forward in this that can then KEPSA bring all sectors around the table. Then we can see some of the interventions that we have promised here. How then can we also have corporates chipping in, and then we have a coordinated aspect by the ministry, and that would also help us to go along with. Thank you so much, Victor.
Thank you so much, Raymond. Eva Kazi-Kwaku, how we coordinate this group to then gel together and complement what government is doing.
We're up to the task, Raymond. We are up to the task.
Thank you so much. I believe
Eva, thank you so much. Eva,
yeah,
thank you so much. I know how you have the capacity.
Kazi kwetu tutafanya. This is our country.
Thank you so much, ladies and gentlemen. I think that's all we had time for. So much we have not covered. And before we end the meeting, please just take note of whatever is in the group chat that is of interest to you. Note it, because as soon as we end this, you may lose them. I've taken a copy for myself. And Raymond, you said there's something you want to put on the group chat. Please do before we close. So otherwise, I want to wish you the very best.
Victor, allow me to share with you. Yeah, I'll send it to you, then you're going to circulate.
Okay.
Yeah,
sorry, Victor, before you close the meeting, I think let me just acknowledge Emma's question about digital platforms to let her know that a lot is happening outside the digital space. I think she was very clear on her question and we need to acknowledge it. So thank you for that. Dr. Patricia already mentioned that we need to work through radio stations, to get more public awareness. Same case goes to the youth. Beyond digital platforms, a lot of evidence has shown that 99% of young people have access to at least a basic phone. So we're trying to ensure that they get information through SMS services in case they do not have access to the internet. Thank you, Emma, for your question.
Raymond, Catherine Kangangi asked you a very, very pertinent question. Why there are no houses for men facing, no safe houses for men, yet they are also facing GBV, the gender-based violence. So, all right.
Thank you so much, Victor. Let me speak for men. As you know, that the maendeleo ya wanaume has not been so strong. And and I must applaud the women on how organized they are. And I know gender, and Eva will say this, I know gender is not only women, it's also looks at men. And I believe also we must also now come out in a very proactive way in the society, as much as it's not so much good thing for an African man to come out, that they are going through GBV. And I believe men go through GBV. You just saw what happened in the news, that a man was burnt into his car. Investigations are going on. Some people are saying, could it be that he was put there dead? He was going through a lot of challenges. So I believe, Eva, again, with your capacity, kazi kwako, please boost our maendeleo ya wanaume and just see how
and men need to come out. Men need to come out.
And men also need to come out and also not feel stigmatized. And lastly, Victor, so that I speak for the last time, I believe also we can also get some few highlight reports from what we have discussed, so that then Eva and all of us, we can now see how can we implement certain interventions.
Thank you so much. Ladies and gentlemen, that's all we had time for. And I want to thank my panelists. I want to thank our participants who have been online for almost 2 hours. And I want to say every Thursday, we have these webinars going on. We will pick the next topic on Monday, and then on Thursday, you can always dial in. We'll be able to send you the dialing in credentials. So happy to have moderated this, and I want to end this by wishing you a very good evening. Thank you so much, and hopefully we see you next week.
Thank you. Bye-bye.
Thank you. Bye, everyone. Bye-bye.
Okay, thank you. Bye.
Thank you. Thank you very much.